Standard occlusion theory for TMD. I am Sotokawa, a dentist practicing in Morioka City, Japan. This theme covers the occlusion theory essential for treating temporomandibular joint disorders, organized into the following 24 topics. This time, I will explain the fifth topic: lateral pterygoid muscle disease. Standard occlusion theory for TMD. 5. Disease of lateral pterygoid muscle. Contents. 1. What is disorders of the lateral pterygoid muscle? 2. Definition, prevalence, pathology. 3. Symptoms and examination. 4. Test findings, diagnosis, differential diagnosis. 5. Causes. A. Originating from teeth grinding induced by functional malocclusion. B. Originating from misalignment between centric relation and occlusal contact. 6. Basic treatment approach. 1. What is disorders of the lateral pterygoid muscle? It is necessary to distinguish it from occlusal disorders. As a condition with clearly defined pathology and causes, there is lateral pterygoid muscle dysfunction. Lateral pterygoid muscle dysfunction is one condition included within occlusal disorders, as shown in the chart on the upper right. Lateral pterygoid muscle disorders range from mild fatigue states to severe cases causing muscle contracture. They constitute a high-frequency disorder, accounting for the majority of what is commonly referred to as temporomandibular joint disorder. 2. Definition, prevalence, pathology. Definition. This condition involves fatigue or muscle spasm in the lateral pterygoid muscle, as illustrated in the image above right. Prevalence. This disorder is said to account for the majority, over 90%, of diseases affecting the structures forming the temporomandibular joint. Pathology. Habitual and excessive contraction of the lateral pterygoid muscle, often due to teeth grinding or clenching, leads to the accumulation of fatigue substances within the muscle. 3. Symptoms and examination. Symptoms. Pain in front of the ear, limited mouth opening, headaches, and stiff shoulders may occur. If the mouth opens no more than 25 to 30 millimeters, no pain is felt. However, opening wider causes the lateral pterygoid muscle to contract, resulting in pain felt in front of the ear. The area of pain can sometimes be extensive. In some cases, it may extend to the temporal region or neck. Examination. The condition can be confirmed by instructing the patient to open their mouth gradually and observing whether pain occurs when the lateral pterygoid muscle contracts at an opening of 25 to 30 millimeters. Additionally, the examiner places a hand on the patient's mandibular chin area and instructs them to push against that hand with their lower jaw. If the lateral pterygoid muscle is impaired, significant pain occurs on the affected side during this maneuver. 4. Test findings, diagnosis, differential diagnosis. Examination findings. As shown in the photo on the right, occlusal analysis is performed using a diagnostic model mounted on a semi-adjustable articulator with a face bow. If malocclusion is detected, it is necessary to analyze the location and condition of the malocclusion, as well as the occlusal state after resolving the malocclusion. Diagnosis and differential diagnosis. A definitive diagnosis is made when symptoms are attributed to a disorder of the lateral pterygoid muscle and the cause is identified. If symptoms include headache, differential diagnosis from other conditions causing headaches is necessary. In such cases, collaboration with other departments is required. Relevant departments for consultation include neurology, psychosomatic medicine, otolaryngology, and orthopedics. 5. Causes. A. Originating from teeth grinding induced by functional malocclusion. When functional malocclusion exists, teeth grinding may be induced as an attempt to resolve the malocclusion. Teeth grinding occurs due to intermittent, strong contractions of the lateral pterygoid muscle on one side. As a result, the lateral pterygoid muscle on that side becomes fatigued and impaired. 5. Causes. B. Originating from misalignment between centric relation and occlusal contact. When a functional malocclusion exists where the occlusal contact position deviates from the centric relation, as shown in the right illustration, the mandibular condyle will be positioned at an unstable area of the mandibular condyle during occlusal contact. When occluding in this state, because the mandibular condyle is positioned on the incline of the mandibular fossa, the lateral pterygoid muscle strongly contracts to maintain the condyle's position, opposing the closing muscles masseter, temporalis, medial pterygoid. However, the lateral pterygoid muscle is smaller compared to other masticatory muscles, making it prone to fatigue and injury. 6. Basic treatment approach. This condition is definitively diagnosed through occlusal analysis, and most cases can be completely cured by implementing causative therapy based on the diagnosis. Causative therapies include occlusal adjustment, removal of prosthetics causing malocclusion, and oral rehabilitation. Symptomatic treatments such as analgesic medication are effective as adjunctive measures to causative therapy. Standard occlusion theory for TMD. 5. Lateral pterygoid muscle disease is now complete. If you enjoyed this topic, please click the like button. If you have any questions or concerns, please write them in the public comment section below. The next topic is the 6. Disorder of posterior disc tissue.